Hello everyone. Today on this lecture we discuss about comprehensive primary health care. We already discussed primary health care and here we are discussing the comprehensive. So it is based upon the same principle or the same foundation of the primary health care. But in primary health care we are providing the essential health services that the person can accessible, acceptable, affordable at a cost the country and the community can afford. So this is the definition of the what? Alma Ata. But here, but in comprehensive primary care, we are providing the person the health services not in ill condition or not in disease condition. We are providing health services throughout his the lifespan from the birth to the death of the individual. Okay, let's see the definition. So comprehensive means wide range of health services, or the comprehensive primary health care is built upon the foundation of the primary health care, and here we are providing which type of services? It's comprised of preventive services. Okay, so preventive means we are not make a person to fall into disease condition, that is called preventive. Okay, because prevention is better than cure. The first, preventive services. Second, promotive services. Those who are in the good condition, their health is good, how their health will be restored, that is the promotive health services. Next, curative. Those who are fall in sick condition or disease condition, treatment will be given them, that is called curative services. Again, after recovery from the illness, how he will live a normal life, we come back to his normal habit, that is called the rehabilitative services. And the fifth one, that is the palliative health services. Here the chronical ill patient or terminally ill patient, they are providing health services, how to relieve their pain, how they can live a comfortable how can spend a life to the death, the comfortable life. So that is the palliative health services that is provided through this comprehensive primary health care. And these services, how it is delivered in the manner of accessible, acceptable, affordable and high quality. We already know accessible, that is rich. It can be rich every everywhere, that is not in the urban, in rural also be it can be reach the people. Acceptable, that is accepted by all the sector of the society, so it will be easily acceptable by the people, individual in the community. Next, affordable, that is you say it is cashless or the cost is very low, so that is called affordable prices. Next, high quality services. Here we will be providing the high quality of services and providing the high quality services to the individual. And these services not in disease condition, from the birth of the individual to death of the person, that is the total throughout his lifespan. When a person born, he is come in the mother womb. From the womb, when he is conceived, then with the baby birth, that is neonate age. Next, child age. Next, adult age. Next, old age, and last one, that is the RIP or in the death condition. So this is called womb to tomb. So throughout his lifespan, he was getting this type of services. This is called comprehensive primary health care. So this concept was actually the Alma Ata from the Alma Ata conference. We get the idea of the primary health care. But in the National Health Policy 2070, by the National Health Policy 2070, is focused on the service of the primary health care. But he found that there are some of the cases, the achievement, will get the achievement in the sector of maternal and infant mortality rate. That also be cases we get the achievement, and the rate of death rate and the morbidity rate, that is decreases. But the non-communicable disease, in the condition non-communicable death due to non-communicable disease or accident or injury, that cases are being they are the in a peak level. So the in national health policy, once we provide health services, that will be included the communicable disease, trauma, injury, accident, mental health problem. So they also can be provided the treatment. So for this treatment, the person have to pay, go for the private or pay for the extra charges. So reduce this out pocket expenditure of the person individual. So National Health Policy in 2017 he bring the concept of primary health care, comprehensive primary health care. This concept was being taken by the Government of India in 2018, and he launched a national health scheme. By this national health scheme, that is now is popularly known as Ayushman Bharat program. So this is Ayushman Bharat program. Here two initiative steps are taken. First one, Pradhan Mantri Jan Arogya Yojana, that is PMJ. Next one, second initiative, providing package of comprehensive primary health care through health wellness clinic. Okay. First one, that is the Pradhan Mantri Jan Arogya Yojana. Here what happened? The people, individual who were suffered a need for the secondary and the tertiary level of treatment, so they can get a cashless treatment up to 5 lakhs per family per year, those who are socio-economically poor. So we get the data from the 2011 census. We have taken the data from the 2011 census. From the data, those who are socio-economically poor, so they are getting the benefits of 5 lakhs per family per year under this PMJ's program scheme. Next initiative, providing the package. We are providing a 12 the wide package, broad range of health services, or you say 12 packages of health services, and that will be called the comprehensive primary health care, that will be provided through the sub center. The health wellness center is the selective sub center where the health services is provided. So that is called the health wellness clinic. This is the platform. In this platform, we are providing the comprehensive primary health care. Let's see what are the package of health services provided through this comprehensive primary health care. First one, the care in pregnancy. So let's see the pregnancy from the mother womb. We are providing the health services. The care in the pregnancy and childbirth, the hospitalization, delivery in the hospitalization, and the immunization to the mother. So that also be provided in the comprehensive primary health care services. Second one, neonatal and infant health care services. After birth to 1 month, we consider as a neonate period. And from the 1 month to 1 year, we consider as a 1 year, we consider as an infant birth. During that time, the immunization or any other health services required to the infant or neonates time, so that also be provided through this comprehensive primary health care. Second one, childhood and adolescence. Now the infant is going to the childhood age, and that time also in adolescence period also health services are provided, that through the comprehensive primary health care. Fourth one, for the family planning and the reproductive health care. Now the baby in the age of 15 to 45 years, that is the reproductive age group, and during that time also providing the health services and the family planning services also be provided. Second one, the fifth one, that the management of national health program in the communicable. So number of national health programs are implemented, communicable disease programs are implemented through the Government of India, like malaria control program, revised tuberculosis control, iodine deficiency disease control program, the blindness control program. These are the programs are going on. So how to? So this program, how this program will smoothly manage, that also be come under the comprehensive health services packages. Sixth package, that the management common diseases, so common fever or any minor illness, discomfort, so that can be well managed by the OPD, outpatient department. No need to hospitalization. So in outpatient department also we were providing the common disease management in the common disease. Screening, prevention, control, and the management of non-communicable NCD. We are calling it the non-CD. That is the cancer, diabetes mellitus, cardiovascular disease, respiratory disease. So these are the number nowadays people are much more suffer with these NCD diseases. So if they are proper screening, proper diagnosis, and takes place in the primary level, so that the disease can be under control. So proper screening, prevention and control and management of non-communicable disease, that also become, this type of health services also become under comprehensive primary health care. Eighth package, care of the common ophthalmic and the ENT problems. So any problem related to eye, cataract or glaucoma, so that can be managed. And also the ENT, the ear, nose, throat, that also be services also be provided through this comprehensive primary health care. Next, ninth one, that the basic oral healthcare. So the oral healthcare also be give focusing the oral healthcare. So we know the for the dental for 6 months of dental checkup, oral hygiene, how to maintain the dental health. So this also be education also be provided, or counseling also be providing through this ninth number of packages. Next, 10th one, the elderly and the palliative health services. The person who is in the old condition, in the geriatric health services, we are calling it the geriatric. So that time also be what are the health services required, that also provided. And also those who are terminally ill or in the chronic cases, that also be health services provided. Emergency and medical services. After all these disease conditions, if any emergency cases, accident, injury, that also be occur, so that also be well managed in the that also be provided in the comprehensive primary health care through this comprehensive primary health care services. Then the 12th one, that is the screening and the basic management of mental health illness. So nowadays, due to stress and environmental change, so mental health elements are very arising. So if where counseling or proper guidance is required, then mental health problem also be controlled in the primary level. So that also be come under the 12 package of health services. These 12 packages or the health services are provided to the individual from the birth to the death of the person. So we're in the whole coverage, we're totally will come under a coverage of health services. So these are the services is provided to the health wellness clinics, that is the selective sub-center. After that, this is the primary level. After that, if the person is need much more health services, need any secondary level of health services or tertiary level of health services, so there also they can be also get around 5 lakhs of cashless treatment in the hospitalization, but they should be under the scheme of the Ayushman Bharat. So this is the two initiatives, that is the government under the Ayushman Yojana. First one, the Pradhan Mantri Jan Arogya Yojana, and second one, the providing the package of comprehensive primary healthcare through the platform of health wellness center, that is the selective sub center. So this is all about the comprehensive primary healthcare. And the definition is if you understand the definition, then it is just to remember, because here we are providing the health services not in the ill condition or in disease condition. We are providing the health services from the birth to the death of a individual. So under this health services, there are 5 health services, that is the preventive, promotive, curative, rehabilitative and the palliative health services are provided. And these health services should be affordable, accessible and acceptable in the high quality of health services. So this is all about the comprehensive primary health care. Thank you for watching, and please keep on subscribing.